Dr. Gretchen Reese here, and I wanted to just do a quick video on thyroid function tests or thyroid labs because I get a lot of questions about this when I'm trying to go over thyroid labs with patients. A lot of people have learned some of what the different tests are, but a lot of people don't understand that TSH is not actually a thyroid hormone. So to start off with, TSH or thyroid stimulating hormone is the main test that every doctor, pretty much every doctor who's ever trained, has ordered and knows how to interpret the TSH test. So that's the main thyroid test that you'll get done. But it's actually not a thyroid hormone itself. It reflects thyroid hormones, but it's not a thyroid hormone. So your actual hormone levels that we can check in the blood are T3 and T4. T4 is the main form of thyroid hormone that your thyroid makes. It's called thyroxine. And then your body turns that T4 into T3. And T3, when it's activated, is the form that can actually get into your cells and helps give your cells energy and help support metabolism and all those things that thyroid hormone does. So T3 is considered more of the active form. That said, we still do rely on TSH for the vast majority of our testing. And you need to understand a little bit about how TSH works. So TSH is thyroid stimulating hormone. It's actually made up in your pituitary gland up in your brain. It's made in response to your brain sensing how much thyroid hormone is running around in your system. So your thyroid gland makes thyroid hormone, which is kind of running around and doing its thing. If that level gets too low because your thyroid is getting sluggish, your brain is going to say, whoa, what's going on? Come on, thyroid, come on, make some more thyroid. And that signal to make more thyroid goes up, thyroid stimulating hormone. Best analogy is if you've ever raised little kids and at the end of the day there's toys all over the living room and you're like, kids, clean up the living room. Kids, clean up the living room. And they're not listening to you. You end up screaming, guys, clean up the living room. You have to amplify the signal to get the results that you want. So the same thing's true. If your thyroid gland is getting sluggish, the signal from the brain ratchets up. So a TSH that is high actually indicates that your thyroid hormone levels have started to sink and they're low. So there's this opposite relationship there. The opposite is therefore true. So if your thyroid gland gets something wrong with it and it starts to become overactive or hyperthyroidism, then the TSH signal from the brain goes down because your thyroid hormone levels are up, but then the TSH goes down. So they balance each other this way. So a lot of people say, well, how's my thyroid test? And I say, well, it's actually a little bit on the high side. And they think, oh, do I have too much thyroid hormone? And then I have to explain this, that it's actually the opposite. So the TSH level on most labs goes, the normal range, depending on which lab you're using, is somewhere between about 0.4 and around 4.5. Those of us, though, in functional medicine do like to see it a little bit on the lower end. Because think about this, if your TSH is running 4.5 all the time, which is the upper limit of normal, it means your pituitary is working a little harder because it's sensing your thyroid is maybe not quite doing its job. So we don't really like to see those high normal TSHs. We like to see them a little bit lower. So somewhere between 0.4 and about 2.5 is probably optimal. To simplify it, I like to say perfect is somewhere in the ones, so 1 to 2 range. But there's lots and lots of people whose TSH is in the 2s, sometimes even the low 3s, and they're totally fine. You also have to take the TSH in the context of the clinical scenario. So again, there are just some people whose TSH is always 3.0, it always has been, it always will be, and they have no problems with their thyroid hormone levels, and they have no symptoms. So just because your TSH is in the 3s doesn't necessarily mean that you would feel any different if you go on thyroid hormone. So we do also look at the T3 and the T4 levels because those are two other hormones, again, that come directly from the thyroid. And those can be useful when the TSH is borderline. So we do use those, but I will say, having come from the conventional allopathic world of family medicine and now in integrative medicine, I don't treat just a T3 and a T4 level if the TSH looks really good. And this sometimes creates a little confusion and sometimes some frustration when I've seen patients who essentially want me to treat them just based on symptoms or just based on the T3, and they want to completely disregard a TSH. And I've had patients who have taken their own thyroid hormone on their own and they're taking like 3 times a normal dose. And when I check their levels, their T4 and T3 are really high, but the TSH is super low, like not even detectable. And that's not good long term, because long term that just means you've got too much thyroid hormone going through your system, and hyperthyroidism, whether it's caused by you or a provider telling you to take too much or your thyroid gland making too much, it's not good long term. It can be a factor in some bone loss or some cardiac issues, fast heart rates, arrhythmias, things like that. So just be aware also that there's a lot of people online, especially non-physician providers. There are some other types of providers that are out there that are not licensed by the medical boards, never went to medical school. Some of them do promote these aggressive treatment regimens for thyroid, where they recommend that you just disregard all your labs and just take enough thyroid hormone, which there's ways you can get it, and they just say treat until you feel like you have energy and you can lose weight, all these symptomatic endpoints. But in doing so, that will over suppress your TSH. So your thyroid hormones go way up here and your TSH goes way down here. And that's just not good long term. Your system can handle it for a short period of time, but long term it's not good. So that's sort of the rundown of those main thyroid hormones. Now the other two things just to mention you might hear about is thyroid antibodies and then reverse T3. So reverse T3 is a really interesting form of thyroid hormone. It's T3, but it's actually flipped and reversed. So it's kind of like a right hand, left hand type of the molecule. So if you have the T3, but then you reverse it, then you end up with this reverse T3. What happens with the regular T3 is it goes into your cells and it does its thing and it supports the cellular metabolism. But the reverse T3 can't get into the cell because it's the wrong configuration. It just can't get in. When you're stressed, your body makes more of the reverse T3 than the active normal T3. So stress is correlated with a lower amount of T3 that's available to your cells, and that's why your metabolism gets sluggish and you get tired, and you can have constipation, symptoms of low thyroid when you're just simply going through stress. So reverse T3 is sometimes useful to look at because if it's elevated, we can treat that with other modalities to help with that stress response to get your body to make more of the active T3. Last test that you should be aware of is thyroid antibodies. Most common one we do is called TPO, which stands for thyroid peroxidase antibodies. These antibodies, they indicate that you've got an autoimmune condition. So your system is making antibodies against your own thyroid gland cells, and that's not good. Like we say in our house, no bueno. What's happening then is that this heightened immunity is attacking your own thyroid tissue, and over time it can and often does lead to a decrease in thyroid function. So that's where we have to step in and treat with certain thyroid medications. But it's also a clue. Like, why is your immune system making antibodies to part of your own natural tissue? What's going on here? And there's a lot of theories as to why we're seeing a steady rise in autoimmunity. There's a lot of factors to that. But if you do have thyroid antibodies, it is most of the time considered, at least if it's low thyroid, it's considered Hashimoto's. It's worth really taking a sort of integrative functional medicine look at that and saying, well, why? Is there a toxic issue that I've got going on in my system? Is it a heavy metal thing? Could it be something related to some other immunological phenomenon? Is it gut health? Do I have gut inflammation and I'm eating the wrong foods? Is there something else? What is going on that's stimulating my immune system? And that's where the functional medicine or naturopathic medicine approach comes in, is just kind of getting to that root cause. So if you have a thyroid condition, if you've never had your TPO checked, it's worth checking. And then if you do have TPO antibodies, it's not something that we directly treat with a medicine, but it then starts to lead you down the rabbit hole of looking for some of these other root causes. And every once in a while, we do see people who really clean up their lifestyle, nutrition, support with supplements, and the TPO can come down over time. And then sometimes that actually leads to you needing less thyroid medication. So as a summary, TSH is inversely related to your actual thyroid hormone levels. Perfect is probably anywhere from 0.4 to about 2 to 2.5. That is the test that we generally do rely on, but there are other circumstances that we add these other tests in. So if you have any other questions, please feel free to give us a call. We'd be happy to see you, and we'd be happy to work with you to help with your thyroid condition. Have a great day.